Hi everyone, it's Jasmine, and today's video focuses on simple things we can do to make sure we are taking our medication safely. So I hope you learned something today, and let's get started. Now, why does medication safety matter? Medicines help treat illness and improve health, so incorrect use can cause serious health problems. Medication errors may lead to allergic reactions, overdose, or ineffective treatment, or other signs and symptoms that can put our health at risk. It's for this reason that safe habits protect you and your family. First things first, to facilitate safe medication management, you want to know your medications. Learn your medications' names and the purpose for the medication and why you're taking it. Understand how to take it and when to take it. Some would be taken with food, others on their own if you have other medications they may interact with, etc. You also want to know possible side effects, and it's a great idea to keep a current list of all the medicines that you're taking, including vitamins and supplements as well. Next, follow directions carefully. Read labels and instructions every time you take the medication. As a nurse, when we give medications, we do what's called the 7 checks and the 7 rights. What this means is you're checking to make sure it's the right person, it's the right medication, it's the right dose, it's being given at the right time, it's being given for the right reason, it's being given through the right route, so whether that is an injectable medication or an oral medication or inhalation, whatever it might be. And then for a nurse, we say the right documentation, but this can apply to individuals as well. And you can make note that yes, at 8 a.m. this morning, I did take my blood pressure medication. Always important if you're using liquid medicine to use measuring devices, as these again are still potent medicines and too much can cause side effects and adverse reactions. And then you never want to stop taking medication without medical advice, whether that be from a nurse, doctor, pharmacist, etc. Now, this point may seem obvious, but it's worth mentioning. Avoid sharing your medications. Prescription medicines are made for one person only, and sharing medicines can be dangerous. Different people may have allergies or health conditions that contraindicate them being able to take your medication and your dose of the medication, and incorrect medicine use can actually worsen illness. Very important as well is medication storage, and you want to make sure you're storing your medications safely. Keep your medicines in their original container, or if you are putting them in a dosette, you can put them in a dry, cool place. Keep medicines away from children and pets at all times, and then make sure you're always checking the expiration dates before taking your medicine. Another important thing that we mentioned a bit earlier is dangerous interactions that medications can have with each other, with foods, other substances, and so on. And it's really important that we have the knowledge to be able to prevent these dangerous interactions. Where does this knowledge come from, you might ask? It can come from a pamphlet and your prescription information that is given to you when you have the medication filled. It can come from your doctor themselves, the pharmacist, and so on. So some medications, again, should not be mixed together. Some substances, such as alcohol and certain foods, may also affect the absorption of medication. Or if we talk about alcohol, it can have a really hard impact if it's taken with medications that are excreted by your liver, because then your liver is working overtime, and that can cause damage in the long term. This is why it's so important that you are communicating openly about the medications, vitamins, and supplements that you're taking to your physician. And you can always ask a pharmacist if you're unsure about interactions. a lot of pharmacists you can just reach by telephone and they will answer your questions over the phone. An example of a food interaction with, quite frankly, a lot of medications is grapefruit. To name a few medications that grapefruit can interact with, but not all of them, these include statins, so cholesterol medications, calcium channel blockers, so medications for your blood pressure, and then anti-anxiety medications like Zoloft, etc. These are medications that truly a lot of people are taking, so this is an important contraindication to know about. Okay, so what do you do if you miss a dose? Again, you can read the instructions and the pamphlet that is typically given with your medications when they are filled. You can take the missed dose only if it's recommended by these instructions or by a healthcare professional. You never want to double a dose unless it's instructed by a healthcare professional. So, again, don't be afraid to reach out to your pharmacist, your doctor, and so on. Now, what happens if side effects do happen from a medication? It's important that we know what side effects are kind of predictable with certain medications and common with certain medications, and what are actual emergencies. So, for a lot of medications, common side effects can include a bit of dizziness, drowsiness, or nausea, but we want to seek medical help for serious reactions such as this nausea progressing to persistent vomiting that can't be stopped, this dizziness or drowsiness leading to a state of feeling extremely drowsy and potentially losing consciousness, having severe chest pain or difficulty breathing, having a severe rash or swelling. This could indicate anaphylaxis to the medications, and a severe allergy. That's a medical emergency. And again, trouble breathing, which can be coupled with this anaphylaxis. Overall, some really important takeaways from today's video is to always take medications exactly as directed by the physician, pharmacist, and instructions. Keep medicines stored safely and organized, and ask healthcare professionals questions when you're unsure. Never just guess. Safe medication habits can truly prevent accidents and protect your health. Thanks for watching.